morning, my name is Rich Bennett. Welcome to Presidential Holistic Dentistry. Today's topic of discussion is periodontal disease and its diagnosis, swelling around the tooth. Peri means around, dont means tooth, and itis means swelling, so literally it's swelling around the tooth. This is an autoimmune disease that doesn't hurt. Why doesn't it hurt? Because your body is attacking its own tissues because it can't tell the difference between the tooth and the bacteria that's attached to the tooth. It's going to spit out your whole tooth, okay? It won't happen immediately, okay, but it's going to happen over time. Number two, okay, you won't know that you have periodontal disease, okay, until you're diagnosed with it. Number three, there is no cure for this disease. Like all autoimmune disease, okay, again, your body is attacking its own tissues, but in the case of periodontal disease, if this is a tooth and this is the root surface, and if this is the gum or the bone covering the tooth, okay, what the uncurable aspect about this disease means is once you lose bone around the tooth, okay, it won't grow back up north. So if it doesn't grow back up north, you won't get it back. I do use a laser, okay, sometimes I might get some bone coming back, okay, but I don't guarantee it. You can maintain this periodontal disease, okay, like all other autoimmune disease, for example, diabetes. You can't cure it, but you can maintain it. You maintain your periodontal disease by keeping the bacteria off the teeth. That is the most important part, I think, of the disease, okay, is not only taking the bacteria off the teeth, which is my job, okay, but then showing you how to maintain your periodontal disease by showing you how to keep the bacteria off the teeth. Now, what are we going to do about periodontal disease and why? Let's start with the why. 50% of all heart attacks and strokes are caused by periodontal pathogens. That means the bacteria that is underneath the gums, okay, these bacteria are secreting toxins. Your body's response to the toxins is an inflammatory response. Inflammation, okay, around the tooth, okay, simply means, okay, this tissue, okay, is becoming swollen, okay. Over the long term, what will happen, your body will release enzymes, okay, and essentially kicking up the tooth because it can't tell the difference between the tooth and the bacteria that's attached to the tooth. It's going to get rid of the whole tooth over time. Now, regarding heart attacks and strokes, okay, this bacteria is transferred from the tooth, okay, to the tissue. That tissue, okay, then transports these periodontal pathogens throughout your body, landing sometimes in a coronary artery. What does it do? It secretes toxins. Your body's response to the toxins is an inflammatory response. You get a blockage. Later on, you can get a heart attack. You can get a stroke. In addition to that, you may also develop dementia, Alzheimer's, diabetes, and all kinds of other autoimmune and other systemic diseases. Thank you.